Hello. This is Morel Benard, and this is Study Coach UK channel on YouTube. Now, here I'm offering some study tips and talking about books for students. Yes. In the previous video, I talked about lowering anxiety when preparing for a presentation. And so in this video now, I aim to offer you some tips on how to give a killer presentation, how to do an absolutely fantastic presentation. When giving the presentation, if you're still feeling anxious, then you will simply have to, what they say, embrace the fear and do a fearsome presentation. You can also call this tough love. You are fearful, and I'm suggesting, though you are fearful, you still need to do it. So embrace the fear, tough love, yeah? And just do it now. But setting aside issues surrounding fear, I would like to try to help you by giving you some presentation tips. And I do like to give credit where credit is due. So just to let you know that these ideas, these tips are based on the work of somebody by the name of, or let's say somebody, the theorist, Richard Nelson Jones. So that's the name of the theorist, Richard Nelson Jones. So, okay, the first point to consider when structuring your presentation is to consider your audience and to consider your volume when you speak. Now, at first, what I'm saying here might seem like a very basic point. It might sound basic, but the fact is that some people sometimes speak to themselves and not to their audience. And in some instances, no matter how often people are actually asked to speak up, they can't maintain an adequate level of volume, and their voice will trail off and become inaudible, or it becomes extremely difficult to hear what they are saying. You literally have to bend your ears and lean forward as much as you can to try to hear them. And when you're giving a presentation, you don't want to be doing that to your dear audience. Cries of, excuse me, could you speak a little louder, please? Or, we can't hear you. These cries often have no impact on the speaker. And the speaker continues on their merry way, talking to themselves. So, my message is, if you know that you have a quiet voice, then ensure that during the presentation you are heard. I would suggest that if you have a friend sitting at the back of the theatre, the lecture room, the room that you're using, they could help you by giving you a thumbs up signal to let you know you are audible, and a thumbs down if your voice begins to disappear within yourself. So that's something you can consider if you know that your volume is likely to trail off. People have said this to you in the past, then have someone at the back of the room who'll be able to give you some signs, to let you know how you're doing in view of volume. All right, I hope that what I'm saying here is of some help to you in respect of using effective volume. Next point, articulation. In a a nutshell, articulation means clear speech. And this goes beyond any specific language. In other words, it doesn't matter what language you speak. You speak Russian, Chinese, Cantonese, whatever it is, Arabic, it doesn't matter. The aim should always be to clearly express the words, to clearly pronounce the words, so that your listeners can understand your message, understand what the presentation is all about. If your words are garbled, in other words, they're not pronounced, then you are unlikely to deliver an effective presentation. And of course, what you want to do is to deliver an effective presentation. So therefore, make sure that you are articulating those words, pronouncing those words. I'll give you another tip for your presentation. And this is, you need to be mindful about rate of speech. Now, what does that mean, Morel? Well, the phrase verbal diarrhea comes to mind. Verbal diarrhea is associated with fast speech. Verbal because, someone is speaking, and diarrhea because the rate of speech is literally gushing out in an uncontrollable manner, as if the speaker has diarrhea and can't control their bowels. So if we get 100 miles, that's not good. Going 100 miles an hour, that is not good. Verbal diarrhea. So don't do verbal diarrhea. Don't have verbal diarrhea. Talking at a fast rate usually indicates that the speaker is feeling stressed, feeling anxious and uncomfortable, and simply wants to get the presentation over with. And I know that we want to get the presentation done, but there's no point in getting it done quickly, out of the way, if it's not effective, then we might as well not do it. And as I said earlier, that though we might be feeling anxious, we still just have to embrace the fear. Life is not very nice sometimes. It makes us have to do things and give us too many challenges. But we can overcome these challenges. So it is like ABC, that if the speaker is speaking at a fast rate, then it will create difficulties for listeners. Your audience is likely to misinterpret words, and overall they have difficulties understanding the presentation. And members of the audience, they might simply stop trying to listen to the rest of the speech. They're there in body, they're hearing, but they're not listening. And so therefore, don't expect much feedback from them. And if they do give feedback, it might not be kind, but hopefully they will be gentle with you. I will give you one more tip. And this is in regard to using emphasis. So we use emphasis when we want listeners to pay attention to certain points or to carry out certain instructions. I'll give you an example. For example, a medical professional might instruct us to take 2 tablets during the day, 1 tablet in the morning before breakfast, and 1 tablet after our evening dinner. emphasis might therefore be placed on the word before breakfast. Before breakfast, we're emphasizing the word before breakfast. And then the other emphasis could be after dinner. So we're taking the 2 tablets for the day, but one must be taken before the breakfast, like first thing you get up. And then when you have your dinner in the evening, that's when you take the others. So the person places emphasis on before breakfast and after dinner. Now, in this context of health, using emphasis, the instructions, if a patient is elderly or if they have hearing issues, then it would be used. That's fine. But, big but, when giving a presentation, we might want to emphasize certain concepts and emphasize certain points. And this is okay, but now the but is consider your audience. Consider your audience. What I mean by this, if you're presenting your work to your work colleagues, your boss, your teacher, then consider their knowledge base. Because if you overemphasize, you might appear to be rude. You might appear to be talking down to your audience, your listeners. So bear this in mind and be mindful when using emphasis. So if we just think about it, you've got your boss there, you've got your manager, and if you're overemphasizing, or your work colleagues, if you're overemphasizing to them, it might be considered that you're trying to talk down to them. So it's okay. Maybe somebody is in hospital and they have an issue with hearing and so forth, but setting those things aside, make sure that you don't overemphasize. Consider your audience. All right. Should I stop there? Yeah. Let's stop. In regards to reading books on the topic of doing presentation, you can consult with study skills books, but do check the content page of study skills books to see if the topic is covered in the book. And do so if you are going to purchase the book. Check the contents before you buy the book. Books linked to interpersonal skills, and the use of verbal and non-verbal communication will also likely to include content on how to develop and improve presentation skills. So that means that the study skills book is one area you can look at, and you can have a look at interpersonal skills as well. And as mentioned, I think I said a little earlier, I said the presentation tips are taken from Richard Nelson Jones. Yes, that's correct. Richard Nelson Jones's work. And you should be able to find Nelson Jones's work on Amazon. Yep. Get an old copy of the book or later copies. But you will, however, need to check the content page of the book to see if presentation is covered in that particular book. Yeah, since the focus might be on something else. He's written quite a bit about counselling. So when you sort of find a book by him, it could be just all about counselling and not actually dealing with the presentation. Yep. So this little video of mine, or my little audio, could, however, prove sufficient for your needs in order for you to improve your presentation skills. So perhaps you might not need the book. You can just refer and listen again to what I've said. And you could leave me a note in the comment box here on YouTube, yes, Study Coach UK channel, And if you need further clarification and any points, then I could just give a little answer in the comments. But I will be back with another video on books for students and study tips. So for now, I will say, see you soon. See you soon, and happy reading, and look out for the next video on study tips, books for students. So I'll see you then in the next video. Take care for now. All right, bye.